Beyond Physical Therapy, and this is my friend Adam with Elite Sport and Spine, and welcome to the next piece of our video series of PT versus chiropractic. We're going to get down into some nitty gritty today, so stay tuned. So the first thing that we're going to start on a positive note. So Adam, what do you like best about being a chiropractor?
I think it's just allowing people or helping people get back to activities that they were limited in doing. Pretty simple. Usually nobody comes into the office. Very rarely people come into our office and be like, get me out of pain. It's like, I can't do X activity and I want to get back to doing X activity. So helping them get back to that would be the reason. I think that's my favorite thing about being a chiropractor.
That's awesome. What are some of the things that you do to help people? What are some tools and trades?
Yeah, so we do a lot of exercises, so rehabilitative exercises to get certain muscles back doing their job properly. Some manual therapy, some soft tissue treatment stuff, and then some adjusting here and there, wherever that's deemed necessary. And the combination of those three seem to work pretty well.
Yeah, awesome. So chiropractors are really known for the adjustment piece of it. And obviously that is an important part of treatment, but can you just maybe tell me a little bit more about that and how you use how you tie that into some of the other parts of your treatment?
Yeah, so the chiropractic adjustment per se is the same thing as just a spinal manipulation, but we will take people through like a graded scale. So if we can do a grade 4 mobilization and get their symptoms to be abolished and we get the range of motion that we're looking for, then we might not need to progress further into any sort of spinal manipulation. And if they are certain, like, for example, people who sit at a desk all day are pretty locked up through like their mid-back. So that's usually a good spot that we can go in there and do some sort of spinal manipulation and get some better thoracic extension and then pair with some exercise. And now we can kind of reprogram the brain to hang on to that extension a little bit longer. So we're not one of those chiropractors that are going to claim that a chiropractic adjustment is going to cure this, that, and the other thing. We just use it as a tool to explore better range of motion in the spine or in joints in the body per se.
Yeah, and really similar with physical therapy. We are trained in spinal manipulation, and so it's just another tool in the toolbox. And any one tool on its own is effective, but any tool in combination with everything else, like you can't build a house with just a hammer. You need all of these other pieces in order to make a true change. And exercise is super important as well, because that helps like you said, reinforce the new movement patterns. If someone was really stiff up here because they've been like this all day, yes, we can help, restore that movement using all these different tools, with, either manipulations or mobilizations, which is basically like moving a joint, but without the noise.
Yeah, the pop.
So, we can, I like to think of it as it's like you're trying to get a rusty hinge to move, you kind of just, you work it, rather than trying to bust through it.
Exactly.
Sometimes joints just respond better to those different grades, every body is different as well. So you have to adjust your treatment based on that kind of a thing. So, so those combinations of things are really, I think, where the magic is at. So, but let's take a little bit of a different spin. So let's say, a potential patient walks into your office. Who is a perfect fit for your office or for chiropractic care?
I think the cliche thing would be, well, everybody should see a chiropractor. There are certain people that the way that we practice is not going to be, we're not going to see eye to eye and stuff. If they're not doing the home exercise program, if they're not listening to the recommendations that we're saying, like for example, if we have somebody who is a power lifter and they have, really injured their back squatting or whatever, we may try to limit them from back squatting and switch it to a front squat if they can do it without pain. But if they continue to back squat and they're not getting any better, well, then we're just kind of beating our head against the wall. So those kind of individuals might not be a great fit. But as far as the person who is not going, did you ask me not or is?
Is, but either way.
I guess they kind of go in
hand. They kind of go hand in hand.
They kind of go hand in hand. But people who are going to be wanting to take an active role in their healthcare, those are the people that are really the patients that we'd like to see.
Yeah.
Because then we can work collaboratively and get them back to their goals that they want.
Right. Right. Not necessarily people who just want to, you know, pop some medication.
Exactly.
And just hope that the symptoms will, you know, go away on their own over time.
Yep.
Yeah, definitely. Like, you know, PT is the same way. You know, it's rare that you'll leave a treatment with me without some kind of homework, because you need that reinforcement. You know, and you know, kind of on my end, you know, the people that I don't want to see are kind of similar. You know, you need to, you can't expect to get better if you don't follow instructions. You know, and the instructions that we give are much like when, like, your medical doctor gives you a prescription. You know, so you take your medication as prescribed, otherwise you're not going to get any better. Same thing with us. We prescribe exercises, we tell you, you know, what you can and can't do. And of course, like, we want you to be as active as possible. We're going to give you all kinds of modifications because, you know, your body responds, right, to, you know, when you continue to be active and continue to exercise rather than, like, completely shut down unless that's absolutely necessary. So, I mean, that's the kind of person that we want to see. People who, you know, want to take charge, you know, of their health and be, you know, proactive and, you know, stay on top of things more. So.
And I think the only other person that might not be a good fit for either physical therapy or chiropractic would be those who are dealing with, like, medical emergencies.
Yes.
Like, for example, if you're starting to pee or poop your pants without being able to stop that, probably not a candidate for conservative care.
Nope.
Or if there's some sort of other major health issue that we can be concerned about, those would also not be somebody that we would want to see in our office, and we would probably refer you out.
Yes, exactly. Neither of us will claim that we can, you know, cure cancer or anything like that. And that's one of the reasons why we're in school for so darn long, is that we are taught how to screen for these things.
Find these red flags. Make sure that we're being able to figure them out and go, wait a minute, something is not right here.
Right. And then refer you to the appropriate person to, you know, get on top of it when more medical management is probably necessary. So, yeah. All right. So, more to come. One more video. Stay tuned, guys.